Hello everyone, this is a rapid overview of suggested priorities for progress within Northern Ireland. With approximately 1 in every 17 people affected by a rare disease at some point in their lives, there are more than 110,000 people affected across Northern Ireland. Some of you will have attended the launch of our Northern Ireland Rare Disease Implementation Plan in 2015, which described actions to be taken forward during 2015 to 2021, with 51 commitments from the UK Rare Disease Strategy. From 2017, recommendations for priority action were sought from our local rare disease community using a variety of methods. Those recommendations were summarised in the appendices for this meeting. Overall, views were obtained from more than 2,000 people living and working with rare diseases across Northern Ireland. In May 2020, a focused knowledge exchange workshop was held with many stakeholders to help prioritise several recommendations for future rare disease progress. Over the past 5 years, consistently top-ranked priorities for action across Northern Ireland include the creation of a national registration service for rare diseases. This registry, NI-RADCAR was proposed as the name, that's the Northern Ireland Rare Diseases and Congenital Abnormalities Registry, should strive to collect high-quality data on every child identified with a congenital anomaly and every person living with a rare disease across Northern Ireland. This would help generate rare disease numbers for Northern Ireland to help with service planning and commissioning, improving patient support and treatment options, comparisons with other nations and countries, and rare disease research, including clinical trial participation. Also requested was a centralised information hub providing a range of relevant rare disease information, including disease-specific information, referral resources, educational resources, links to key services and support groups. This hub would be complemented by an information coordinator who would work with the registry team and clinical leads for rare diseases, for example, to facilitate developing care pathways or models of care for rare diseases. There are a few quotes from patients on this slide. So thinking about genomics first, our Northern Ireland Virtual Genomic Medicine Centre was established to facilitate patients with rare diseases receiving a very new type of very detailed genetic testing known as whole genome sequencing. This has resulted in new diagnoses for approximately 22% of patients, often where traditional genetic testing had failed to provide a cause for their disease. Overall, patients and healthcare professionals were very excited about this approach and described participating as a very positive experience. For the future, recommendations included that genetic tests made available through the UK National Genetic Test Directory should also be available to Northern Ireland residents, and that includes whole genome sequencing. They suggested options should be explored to enhance prenatal and newborn genetic-based screening and testing. We know that clinical academic partnerships have proven essential to help diagnose more complex rare diseases, and we also need improved descriptions and adequate coding of rare diseases to help us maximise those all-important diagnoses. An information hub is required to provide peer, that's both patient and professional peer networking, as well as signposting to accurate information about individual diseases and relevant support groups. More than half of participants requested improved communication and a peer support facility, while 86% of them requested direct access to their genetic data as part of an online patient portal. The 3 priority action reports from our last Rare Disease Implementation Plan had a focus on information and communication, education, and the Rare Disease Registry. There was 46 recommendations across those individual reports that were consolidated to 34 priorities and ranked into short, medium, and longer term objectives. The group has also suggested that regular intention to deliver plans and progress updates should be shared with the local rare disease community. Genetics was considered separately. Other recommendations were consolidated under the proposed NI-RADCAR and Information Hub within a Rare Disease Centre for Northern Ireland. Streamlined priorities with suggested deliverables were created to support rare disease progress within Northern Ireland as illustrated on this slide. The 2 top priorities were to establish a rare disease registry and the Information and Communication Hub, initially by forming a collaborative steering group who meet regularly with SMART objectives and reporting timelines for each element. Several staff will be required to deliver on these recommendations. It was suggested that technology-driven improvements to improve access to information may be facilitated by Encompass, for example, developing a patient portal and exploring computer-assisted diagnoses and decision-making tools for rare diseases. Training and education recommendations included the appointment of a training and education coordinator to oversee delivery of individual recommendations. We're very conscious that from this workshop report was published, some things may have changed, not least of which is the publication of the UK's new framework for rare diseases. Today's discussions are to seek your views on priorities to inform a Northern Ireland action plan for rare diseases, and this will be aligned to the UK's rare disease frameworks for the very 4 high-level priorities. Many of our existing recommendations fit within multiple priority areas in this UK document, so for discussion today, we've pragmatically placed them into one of the 4 areas for discussion. Please do share your top-ranked priorities and add anything that you think is missing at this very early stage of information gathering.